Hello, everybody. Today I am presenting my community intervention for at-risk youth. So this intervention was designed to meet the needs of youth ages 11 to 17 who are either currently involved in the juvenile justice system or at risk of becoming involved. The core goal is to expand access to behavioral, educational, and social supports through a single-day community-based event. This approach is grounded in three key frameworks: ecological systems theory, the generalist change process model, and the dynamic advocacy practice and policy model. So historically, youth were treated similarly to adults in the justice system. They were arrested and housed in jails with adults. However, over time, reform efforts like the Juvenile Justice and Delinquency Prevention Act shifted policy towards rehabilitation and diversion programs. However, despite this, gaps remain, especially in early intervention and mental health access. Research shows that unaddressed behavioral and mental health needs are significant predictors of system involvement. And so I've actually, in my research, recognized that this is kind of a cyclical pattern in which policies are aimed toward diversion and then go back towards punishment-oriented reforms. And during those punishment-oriented policies, we'll see a rise in juvenile crime, and then it just kind of shifts back and forth. Less than 1% of our current delinquency programs are evidence-based, and so this shows a need to review our programs as they address juvenile delinquency. So the target populations between ages 11 and 17, they may already be on probation. They may be identified by school counselors or therapists as high risk due to behavioral concerns. Many face compounding issues such as poverty, trauma, and educational disengagement. They're referred by schools, therapists, probation officers, or guardians who recognize the behavioral issues. So my intervention concept builds on an existing annual fundraising event that's hosted by Morgan Children's Fund. That's under the umbrella of Morgan Health Centers, which is where I do my internship. Traditionally, the fund is focused on raising money during a fundraising event that's hosted annually. This event would be expanded to include different types of providers, educational resources, mentorship programs. And the activities are both educational and recreational, creating a space that feels safe, welcoming, and accessible. The key goal is to foster protective factors and build resiliency. So here are those objectives laid out: building resiliency, connecting families and youth to services, and fostering cross-provider collaboration. So I defined my framework by using the SMART structure. Specifically, we aim to connect at least 50 youth and their families and bring in 25 local service providers. Evaluation will involve quantitative attendance tracking and qualitative surveys to assess participant satisfaction and awareness of services. These tools help to determine the event's impact and guide future improvements. So this is what the generalist process change model looked like for me. So engagement involves the community and agency participation, having those different service providers at one location with participants, so that we're able to cross-communicate across different organizations and connect those resources to individuals. The assessment process included identifying risks, which one of those were mental health disorders, barriers, so organizations that might struggle to get their services out there to individuals, or putting on an event that is free for this population would be ideal. And then protective factors, so building up community, connecting individuals with available resources. The planning part of this process involved reaching out to different organizations about collaborating on participating in this event and getting approval from the organization. One of the stipulations the organization required is to get a solid yes from other organizations in participating, putting up a booth, or just attending the event. The intervention has not yet been implemented. We haven't had that annual fundraiser yet. The planning of the fundraiser has started, but it's not going to happen until around the end of July. And then the evaluation process looks like looking at those surveys, which we'll see at the end, and then getting feedback from providers within the organization and then other service providers attending the event. This is what my dynamic advocacy and practice model looks like. So offering access to mental health, education, and a sense of belonging at that event would be important, since a community was a big predictive resilience factor for youth. Offering a supportive environment, so cross-agency participation with family involvement, and the economic and social justice aspect is offering that event um, free free, and it's locally focused, reducing barriers by making it an event that anybody can attend. And political access, bringing together providers of influence, families, encourages discourse. So what I meant by that is that those family members and youth are able to share their experience with providers. I think it also offers the opportunity to start a discussion based on the different programs that are available in the area. And then potentially in the future, I was thinking that having this event right before the school year started would be, I feel like it would give students access to resources right before they're involved in school so that we can expand on like school activities or after school activities, counseling sessions, all that kind of wrapped up around the same time, and then maybe eventually move towards involving schools in participating, and especially school counselors that can help identify behavioral concerns for students. So this was my evaluation of organizational fit and sustainability. So looking at Morgan Children's Fund, I felt like this offered a structure that I could jump in to build upon instead of starting just from scratch. There's already an existing demographic within that organization, and they already hold annual fundraising events. My long-term vision is to connecting an interconnecting network of service providers. And then I did see that there aren't currently grant eligibility opportunities through the Office of Juvenile Justice and Delinquency Prevention, but there are yearly grant opportunities. So maybe looking at um, obtaining fundraising through grants in the future after this year's event, or when it's caught on a little bit more so that we have an established history of functioning. Why it matters. So one of the things I found without my research that I'm not sure that I mentioned was that only 1% of programs aimed at delinquency are actually evidence-based. And so this doesn't just respond to an issue of programs that aren't effectively offering support for juvenile rehabilitation, but it gets at the root instead of treating the symptoms of the aftermath of being involved in the legal justice system. And this is the evaluation that I came up with for participants to kind of get an idea of how they felt about the event. This is what my advocacy policy and practice model looks like in visual representation. And I just thought it would be fun to put up that landing page. This is a flyer that I made a couple years ago for the Morgan Children's fundraiser to give you an idea of what that event looks like. We weren't able to do it last year because I was out of state, and so we didn't have anybody to organize it. But at these events, we usually do different kinds of games. We have live music, free food. We also have a food truck we have free food, but then we also have a food truck if people want to get something from the food truck. And this would just be, my proposal would just be wrapped up into this fundraiser that is held annually. And that is all. Thank you.